Hi, I'm Brad Burkhart. I'm an orthopedic surgeon and I'm fellowship trained in sports medicine. I did a fellowship in Cincinnati with the Cincinnati Bengals as well as with the University of Cincinnati, and I've been in private practice in North Carolina for the past 2.5 years, and I'm happy to be back in Orlando, Florida, which I kind of consider my home, working with Orlando Orthopedic Center. I was originally an Army brat and was born in Georgia, in Augusta, Georgia, and then I grew up in Philadelphia and Pennsylvania, or excuse me, Philadelphia and New Jersey, and did a little bit of time in Delaware, and came down here to train, back up to Ohio, and then I spent 2 years in Asheville, North Carolina, practicing in private practice, and we decided we liked Florida the best, so we came back. I gotta say that the thing I like most about Orlando is the level of activity here. I like to be in an area where people want to be outdoors, and there's a lot of things to do, there's a lot of places to go, and it's in general a very active, energetic community. So the most common injuries that I see as a sports medicine physician are shoulders and knee injuries. And in the knee, the more common injuries are sprains and strains, also some surgical injuries that can include meniscus tears, and then more serious injuries like ACL ruptures and also multi-ligamentous injuries, all of which on the surgical side can require obviously surgery, and then on the non-surgical side, conservative treatment. In the shoulder, I see labral tears, rotator cuff tears, and things that are simpler, including impingement and rotator cuff strains. And I think as a sports medicine physician, the injuries that we see are in people who want to be active and get back to their activities, and we try to do the best we can to get people back to those activities. The thing that I like to treat the most are, if we step back, I like treating athletes and people who are active, but that can include the whole gamut of patients, from an 8-year-old who's trying out for Little League Baseball to the 70-year-old who plays tennis on a regular basis. But some of the injuries that I do enjoy treating are rotator cuff tears, and pretty much anything in the shoulder. I also like knee injuries. I like to do ACL reconstructions and take care of pretty much any and all simple and complex injuries of both the shoulder and the knee. I really went into medical school looking to help people who are active remain active. And my goal, especially going into sports medicine, was to sort of surround myself with people who want to get better and to help them do that. So my favorite thing really is working with people who are active and energetic and want to continue being so. Sports medicine kind of came to me. I was an athlete. I played college basketball, and my brothers, I'm one of 6 boys, and we were always involved in sports. Somebody was injured most of the time, so we were always involved with recovery and getting better. And just through that process of being an athlete for most of my life, I came across a lot of people in the sports medicine field, and from a pretty young age I knew I wanted to get into sports medicine, and that's kind of where I was led as I went through medical school. I really think the most rewarding aspect is getting somebody back to the sport they want and have them be able to participate at the level they were before they were injured. And it's nice to be able to take somebody who is injured while playing and who has a career in mind. Maybe it's just I want to play tennis every weekend, or it's I want to go play college football, and get those people from an injured state back to being able to play. I also enjoy, working with athletes of any level. I was lucky enough to work with the Cincinnati Bengals and with some Division I college athletes as well as high school athletes, and that's one of the better things I get to do is just interact with a lot of people on